Hello everyone, my name is Mary Ellen Coram, and with me today is my colleague, Laura Brooks.
Hi there.
We work at the Pennsylvania Medical Society in practice support, and today we're going to be talking to you about PQRS. I'm sure a lot of you are familiar with that program. It's a pay-for-reporting program that's used to incentivize or to offer incentive payments and also downward adjustments to entice physicians to report on certain quality measures. This was the last year for incentive payments for the program, and now physicians are going to have to successfully report just in order to not get dinged.
Right.
Beginning in 2015, a downward payment adjustment was applied. I'm sure some of you have already gotten notices in the mail. We've certainly been getting calls from a lot of people. How about it, Laura?
Absolutely.
Yeah. This is a 2-year look back, so people who are having their payments adjusted today are because of the failure to report in 2013. And I know that the 2015 physician fee schedule just came out, and that's usually where they let us know about the changes in PQRS for the upcoming year. So Laura, I do understand that there were some changes in 2015, and can you tell us about that?
Absolutely. Every reporting year, CMS essentially adds, deletes, and revises measures groups, and their specifications. 2015 was no exception to that. For those that have previously reported 2013, 2014, you may want to review those measures to ensure that, one, they still exist, and any of the specifications, if there were changes to like the quality data codes themselves, that they're still accurate at this point. The most significant change when you're reporting for 2015 is, and to avoid the 2% payment adjustment as you had indicated, is that eligible professionals must report at least 9 measures across 3 National Quality Strategy domains, or NQS domains, for 50% of their Medicare Part B patients. Of those 9 measures, if an eligible professional has seen at least 1 Medicare patient in a face-to-face encounter, they're now required to report 1 cross-cutting measure from the Crosscutting Measures group. Crosscutting Measures group is 19 measures that are defined as measures of improvement with the patient's functional status. They include measures such as medication reconciliation, documentation of the medication in the patient's medical records, and preventive measures such as tobacco cessation, BMI screening. By the way, when we talk about face-to-face, that includes your office visits, outpatient visits, surgical visit. It does not include telehealth services. If there are fewer, for those that may not have 9 measures that apply to their specialty, and that may very well happen, eligible professionals can still participate in the program, but just keep in mind it will trigger the Medicare Applicability Validation, or MAView review. Mm-hmm. If I may add, when we talk about who is considered an eligible professional, we're talking about our physicians and non-physician practitioners such as CRMPs, PAs, nurse midwives, optometrists, audiologists, and therapists, physical and occupational therapists.
So all those provider types are obligated to report the measures, and failure to do so, their payments would be penalized as well.
That's correct,
okay.
And that list is not the entire list. Mm-hmm. All the eligible professionals are listed on the CMS website.
Laura, I do have a question for you, because I know we get this a lot. People will call us and say, when you talk about, Medicare patients, 50% of your Medicare patients, what does that actually mean? Because we have Medicare Advantage patients as well.
That's a good point. That is a good point. Medicare Advantage would not be considered part of that 50%. It would be your Medicare fee-for-service, your plain old straight Medicare Part B fee-for-service, in addition to Railroad Medicare and Medicare Part B as a secondary payer.
Oh, good. That's helpful to know. It sounds like they increased the minimum reporting threshold from last year. Mm-hmm. It's 3 and now it's 9, like you said. So I understand that physicians do have some options as well. How are they going to report their measures? There might be a couple different options. Can you talk about that?
There are a couple of different options, yes. 2 ways of reporting. You can report as an individual, or the group reporting option. So let's start first with the individual reporting option. Eligible professionals may report via claims, qualified registry, qualified clinical data registry, or a QCDR, or direct EHR or EHR submission vendor. So this is essentially where you could align meaningful use with the PQRS program. Now, there's some slight nuances with the different reporting options, but generally speaking, we're looking at, again, those 9 measures across 3 NQS domains for 50% of your Medicare Part B patients, and the inclusion of that one cross-cutting measure that's part of your 9 that you would need to report.
In terms of the reporting requirements then, you said claims, you said registry reporting, and the requirements for the individual claims and the registry pretty much the same then?
Pretty much the same, with the exception, claims-based, you're looking at 9 measures across 3 NQS domains, that one cross-cutting measure. With the registry, the qualified registry, there's also the addition of a measures group. Measures groups are reportable via registry only. That claim-based reporting of that measures group was eliminated in 2014. The measures groups have also been redefined as a subset of 6 or more PQRS measures that have a particular condition or focus in common.
Am I imagining this, or does it seem like maybe they're trying to do away with the claims, individual claims reporting, or what do you think?
Yeah, it's definitely not your imagination. That's the trend. I see that's where we're going, especially with the qualified registries, the qualified clinical data registry. That's definitely the direction we're heading.
You know, I have no idea, but I wish I did know so I could share it with them. I wonder how many people, reporters, successful reporters, utilize the registry or EHR versus individual. I suspect that if they do away with the individual reporting, we're going to have some unhappy providers.
Oh, I agree. I agree completely. We talked about the individual reporting option. Now let's take a look at the group reporting option.
Okay.
So groups of 2 or more, they've kind of expanded it now to include those groups of 2 or more that self-nominate to report as a GPRO must do so by June 30th. There have been some changes there. In previous years, they had until September 30th to self-nominate, but now we're looking at June 30th of 2015. Groups can report via web interface, qualified registry, direct EHR, or the EHR submission vendor. Without getting into too much detail, each of these have varying numbers of measures and requirements depending on the size of the group and the reporting option selected.
Well, in terms of the group reporting and the requirements, whether it be with the web interface, for the web interface, for the registry, et cetera, we're still talking pretty much those basic 9 measures, 3 to... Okay.
Correct.
Okay.
Yeah.
I mentioned at the beginning of our conversation today that physicians were going to have an added incentive to report PQRS in 2015. And do you want to tell our listeners why?
Sure.
There might be an even better reason in 2015.
The Affordable Care Act requires Medicare to implement what they call the value-based payment modifier, which affects a physician or the eligible professional's reimbursement based on quality and cost of care provided to Medicare beneficiaries enrolled in traditional fee-for-service program. The value-based payment modifier will be implemented in 2017 for all practices, regardless of your size. So solo practitioners, groups of 2 or more will be affected by this.
Well, Laura, thank you so much. There was a lot of good information today. She knows her stuff, really. And what do you say we do this again?
Oh, I'd love to.
Maybe we can get together and talk to you next time about the value-based payment modifier. You up for that?
Sounds like a plan.
All right. You can learn more about this issue, value-based payment modifier, and a lot of other good information at our spring practice administrator meetings.